evening, friends. I'm Dr. Sushant Soni. I'm from AIMS Delhi and I'm the Pathology faculty on the Unacademy app. So let us start. Let us start with our important topic, that is inflammatory mediators. If you are able to hear me, please give me a yes. Comfortable, comfortable. Just a sec. Okay, so starting with inflammatory mediators, we can divide the inflammatory mediators. I was just searching for the link. Okay, so we can divide the inflammatory mediators into two main categories. I can divide the inflammatory mediators into two categories. Now, before we go further, inflammatory mediators, it is an important topic of general pathology which has been asked, which questions in which are coming from time immemorial. The recent two papers, that is the November AIMS 2019 as well as this 5th January NEET, there were a total of 3 questions from this small but an important topic itself. We will be seeing those. So, first point, I can divide the inflammatory mediators into two categories, that is the preformed inflammatory mediators, the preformed or the preformed cellular inflammatory mediators, and the next is newly synthesized. The next is newly synthesized inflammatory mediators. Newly synthesized mediators. These will be the two main categories which we'll be looking forward to today. The third category of inflammatory mediators, these two belong to the cellular category, the preformed cellular and the newly synthesized mediators. The third category are the plasma mediators. The third category of inflammatory mediators are the plasma mediators, which are the kinin and complement pathways, which are kinin and complement pathways and the clotting systems. The kinin and the complement pathways and the clotting systems Next point. So let us start with our classification. The preformed cellular mediators. They are histamine. The preformed cellular mediators, they are histamine, serotonin, heparin, and lysosomal enzymes. These are the preformed cellular mediators. The newly synthesized mediators being chemokines, next cytokines, arachidonic acid metabolites, next arachidonic acid metabolites, next PAF, that is platelet activating factor, and the last is nitric oxide. So this is the classification of inflammatory mediators. A very genuine request from my side, all the students who are watching, Bache, please make notes. This is an important topic and it is factual in the sense that it is volatile. We guys tend to forget this. Please make notes. Making notes is important. So first point, in this half an hour discussion, we will be targeting histamine, serotonin, chemokines and cytokines. We'll take care of these 4 important inflammatory mediators. Starting with the first set, that is histamine and serotonin. First point, they are called as vasoactive amines. Starting with histamine. Starting with the first one, that is histamine. Histamine, this is a vasoactive amine. Vasoactive amine means that it acts on the blood vessels. Both histamine and serotonin are vasoactive amines. Next point, it is among the first mediators. Histamine, it is among the first mediators, to be released, among the first mediators to be released in inflammation. Among the first mediators to be released because it is a preformed mediator. Next point, a rich source of histamine. Histamine, one of the richest sources of histamine is mast cells. One of the richest sources for histamine is mast cells. Please put a star. First point, how do we identify a mast cell? Stain used. Stain used for mast cells. This was last year's MEMS question, that is MEMS 2019. Simple one-liner. Stain used for mast cells, toluidine blue. Stain used for mast cells, toluidine blue. Next point, where are the mast cells normally located? Normally they are present in connective tissue. Normally they are present in connective tissue. Adjacent to blood vessels. So what we have seen is histamine is a vasoactive amine. It is a preformed mediator, so it is among the first mediators to be released in inflammation. Next, one of the richest sources of histamine is mast cells. Next point, the other sources of histamine, the other sources being basophils. Other sources of histamine being basophils and platelets. Next point, what is the role of histamine? Next point, role or function. Role of histamine. Histamine, it causes vasodilation. First point, histamine causes vasodilation. Next, it increases the permeability. It increases the vascular permeability. By which mechanism? In inflammation, we saw that there are three main mechanisms of increased vascular permeability. First was immediate transient, that is permeability increased immediately for a shorter time, immediate transient. Next is immediate prolonged, that is permeability increased immediately for a longer time, and the last is delayed prolonged. So these were the three mechanisms of increased permeability. Histamine, it increases the vascular permeability by immediate transient mechanism. It is an immediate transient increase. It increased immediately for a shorter time. Short time being 20 to 30 minutes. Next, the most common vessel affected in increased permeability is arterioles, capillaries, venules, and venules. Most common vessel affected is the post-capillary venules. And lastly, it causes an increased permeability by endothelial contraction. Please note, it is endothelial contraction and not retraction. Endothelial contraction. This is the role of histamine. Lastly, histamine, it also causes increased smooth muscle contraction. That is, it is responsible for bronchoconstriction. This is the role of histamine. Next point, you very well know that now NEET is gradually being replaced by next. More clinically oriented questions are being asked. So let us go a step further in this. Histamine, it acts by H1 receptors. Histamine, it acts by H1 receptors. It acts by the action of H1 receptors on microvascular endothelial cells. It acts by H1 receptors on microvascular endothelial cells. On microvascular endothelial cells. So I can safely say H1 antagonists. So I can safely say H1 antagonists, that is the drugs which will inhibit the H1 receptors. H1 antagonists, they are bind and block the receptor. Obviously, they bind and block the receptors. Firstly, and next they are used to treat allergies because this causes an immediate transient increase. So they are used to treat allergies. This is the first mediator, the first preformed mediator, that is histamine. Next point. You very well know that histamine and serotonin are vasoactive amines. So let us have a look at serotonin. Also. Serotonin, just 1-2 lines, nothing major. The main topic that I want to start today with you are the chemokines. So serotonin, this is again the rich source is platelets. The richest source of serotonin is again platelets. Next point, the primary function is it acts as a neurotransmitter. The primary function is it acts as a neurotransmitter in GIT. The primary function of serotonin. Next, it is also a vasoconstrictor. Next point, serotonin, it is also a vasoconstrictor. Not much concerned. Next, when we will do inflammation and the topic in details, we will have a look at the other preformed mediators, that is heparin and lysosomal enzymes. Just quickly, lysosomal enzymes, the granules are divided into 3 parts: primary or eosinophilic, secondary or specific, tertiary. The main tertiary granule is answer gelatinases. Rest, primary and secondary and their clinical implications, will do it in inflammation. Next, starting with our main topic for today, that is chemokines. That is the newly synthesized mediators, chemokines. Extremely important. So chemokines, the name tells you everything. Chemokine, so it will be chemotactic for a particular cell. So first point, starting with the general points. Chemokines, they are a family of 8 to 10 kilodalton proteins. Which play a role in chemotaxis of various cells. Pretty obvious. Now, point is, I can classify the chemokines, that is classification, on the basis of conserved cysteine residues. Chemokines, the classification is based on the basis of conserved cysteine residues, which is written in short as CCR. What do we mean by this? Chemokines, as a general rule, have 4 conserved cysteine residues. देखो बच्चे, when you usually have a class, A particular person sits in a chair, the second will be in another chair, and so on. Those positions are almost fixed. The next day also they will almost sit in the same position. This is what we mean by conserved cysteine residues. Chemokines, as a general rule, have cysteines at four locations which are always present there. Four conserved cysteine residues. So I can classify chemokines on the basis of this into four categories. I can classify them into four categories, which are CXC, CC, C, and CX3C. I can classify the chemokines into four categories, where X stands for an amino acid. So CXC, how many chemokines are there? How many amino acids are there? One amino acid. 1X, one amino acid between the first two conserved cysteine residues. CXC, there is one amino acid between the first two conserved cysteine residues. Next, CC, how many amino acids are there? There is no amino acid. There is no amino acid between the first two conserved cysteine residues. What it means is there was cysteine in a chemokine was located at four positions. Those positions are almost fixed. In CXC, there was one amino acid between the first two. CC, no amino acid. C, in C, one C is also missing. So the first and the third conserved cysteine residues. First and the third conserved cysteine residues are deleted. One C was also missing. And last is CX3C, which has three amino acids between the first two conserved cysteine residues. Three amino acids. Next, this is not important. What is important is these classes of chemokines, they are chemotactic for a particular cell. Which cell? The first class is chemotactic for neutrophils. The second is for all leukocytes except neutrophils. Third is for lymphocytes. And the last is monocytes. Easy to remember. Neutrophils, all leukocytes except neutrophils, lymphocytes, monocytes. Next point. What are the chemokines in these categories? Neutrophils. You very well know the first cell of acute inflammation is neutrophil. Which are the acute inflammatory mediators? Acute inflammation causes fever and sepsis. That is most potent pathogen, interleukin 1, followed by interleukin 6. Other cells, other chemokines in this category are interleukin 8 and main role in sepsis, TNF alpha. So neutrophils, interleukin 1, 6, 8, TNF alpha. Next, all leukocytes except neutrophils. Which ones are left? Eosinophils. Which ones are left? Eosinophils. That is eotaxin. Eotaxin. Next, monocytes. Where the chemokine is MCP1, which stands for monocyte chemoattractant protein. MCP1. So monocytes, there are two. One is MCP1 and the next chemokine for activation of monocytes is MIP1 alpha. that is macrophage inflammatory protein, that is macrophage inflammatory protein 1 alpha, macrophage inflammatory protein 1 alpha, MIP 1 alpha. And the last is T cells, where the chemokinase rentis, that is regulated and normal T cell expressed and secreted. I'll repeat, rentis. The full form is not needed. Regulated and normal T cell expressed and secreted. So what we have seen here is all leukocytes except neutrophils, which are eosinophils, eotaxin, monocytes, MCP1 and macrophage inflammatory protein 1 alpha, and T cells rentis. Next, the third class is lymphocytes, where the chemokine associated is lymphotactin, and the last is monocytes, where the chemokine is fract alkaline. Monocytes, where the chemokine is fract alkaline. These are the chemokines. Last point, the first three classes, they are also called as alpha, beta and gamma chemokines. The first three, they are also called as alpha, beta and gamma chemokines. These are the four classes: CXC, CC, C and CX3C. These are the four classes of chemokines, where X stands for an amino acid. This bache is important. These are the chemokines. They will be chemotactic for a particular cell. So if you just read it once or twice, you will be okay with it. These are the various classes of chemokines. Next, this gets us to the next inflammatory mediator. That is cytokines. Let us have a look. In today's session, I wanted to discuss four. That is histamine and serotonin, the preformed mediators to some extent, chemokines and cytokines. So this starts us with cytokines. First point. Starting with cytokines, I can divide the cytokines into two types, that is the acute and the chronic inflammatory mediators. I can divide the cytokines into two categories, that is acute cytokines and chronic cytokines. First point, acute inflammation. The main cell of acute inflammation is neutrophil. So acute cytokines play a role. They play a role in neutrophil activation. Acute cytokines, they play a role in neutrophil activation. Next point, and the acute inflammatory mediators are interleukins. They are interleukins 1, 6, 8, TNF alpha. Nothing major. My main point of concern here is the chronic cytokines. Chronic cytokines, which is the main cell of chronic inflammation? Next, I just had a look at the chats, bache. Somehow my phone was giving some issues. You are right. You are right. The classification Venkat was right. Interleukin 6, important cytokine in multiple myeloma. We will be doing the cytokines in detail. Next, which is the main cell of chronic inflammation? That is the main cell of chronic inflammation. That is macrophage. Main cell of chronic inflammation, macrophages. So chronic cytokines play a role. They play a role in macrophage activation. Macrophage activation. Next one, macrophages is a better answer as compared to lymphocytes. The cell of chronic inflammation, macrophages. Next point. So, chronic cytokines will play a role in which hypersensitivity? 1, 2, 3, 4. Type 4, that is the cell mediated or delayed type. It plays a role in type 4, that is cell mediated or the delayed type of hypersensitivity. They play a role in cell mediated or delayed type of hypersensitivity. And the chronic cytokines are interleukin 12, and interferon gamma. This is important now. The chronic cytokines, they are interleukin 12 and interferon gamma. Next point. Let us see the role of various cytokines with respect to the diseases associated. Firstly, starting with fever. Fever, that is most potent pyrogen. These all the statements that we are writing extremely important. Most potent pyrogen, interleukin 1, has been asked so many times that now they don't even ask this. Followed by interleukin 6. Please don't say it as interleukin 10, that is anti-inflammatory. We'll see that. Followed by interleukin 6. Followed by, if this was also not given in the options, this was last year's All India question, that is NEET, January NEET 2019 question. Followed by PGE2. Followed by prostaglandin E2. Next, main role in ARDS. Next point, the cytokine which plays a main role in acute respiratory distress syndrome, ARDS. It's an acute respiratory distress, so acute cytokines, interleukin 1, 6, 8, TNF alpha, that's okay. But if you have to mark one, the main role in ARDS, interleukin 8. Next point, cells involved in type 1 hypersensitivity. Cells involved in type 1 hypersensitivity, that is allergy or asthma. You very well know the main cell is mast cells, followed by eosinophils and basophils. Main cell is mast cells, followed by eosinophils and basophils. From this line itself, we had two questions in recent exams. How? Firstly, most potent activator of eosinophils. First point, most potent activator of eosinophils, interleukin 5, followed by interleukin 4. Most potent activator of eosinophils, interleukin 5, followed by interleukin 4. Next, most potent activator of basophils. Next point, this was this November AIMS 2019 question. Most potent activator of basophils. The best answer is interleukin 3, followed by interleukin 4. So interleukin 3 was not given in the options. Your answer becomes interleukin 4. Next, main cytokine. Main cytokine which plays a role in fibrosis. TGF beta, that is transforming growth factor beta, TGF beta. Next, put a double star, anti-inflammatory mediators. Next, anti-inflammatory mediators. Extremely important, repeatedly asked. There are three main anti-inflammatory mediators, which are interleukin 10, which are interleukin 10, TGF beta, transforming growth factor beta, and lipoxins. Very important, very important. Other than these three, all others are pro-inflammatory, that is, they cause inflammation. Other than these three, interleukin 10, TGF beta, lipoxins. Lipoxins, you very well know, is a arachidonic acid metabolite, lipoxygenase pathway. Next point, both pro and anti-inflammatory. Next point, the mediators which are both pro and anti-inflammatory. You are right, Venkat. Granuloma formation, interferon gamma. Agreed. Next, both pro and anti-inflammatory. That is, they have both the effects. Pro and anti-inflammatory is interleukin 6, interleukin 6 and interleukin 8, along with interleukin 4. 4, 6 and 8, these are both pro and anti-inflammatory in nature. Both pro and anti-inflammatory in nature. Next, as you have already told me, granuloma formation. Granuloma formation is by interferon gamma. Granuloma formation is by interferon gamma. Next, so this was the topic that I wanted to discuss. Before we go to the questions which came in the paper, quick recap for the students who joined us late. But we discussed the inflammatory mediators today. This was an important topic from both the second years as well as third years and interns viewpoint. Numerous short note, long question in your second year prof, as well as MCQs come from this. I can divide the preformed mediators into cellular and plasma. Plasma mediators were kinin clotting systems complement. Not interested in this lecture today. Cellular were of two types, the preformed cellular and newly synthesized. Preformed were histamine, serotonin, which were the vasoactive amines. Newly synthesized were chemokines and cytokines. These were the classification of chemokines on the basis of cysteine residues. 4 classes: CXC, CC, C and CX3C, which plays a role for activation of neutrophils, all leukocytes except neutrophils, lymphocytes and monocytes, which plays a role for activation of these cells, and these were the chemokines associated with those classes. Next, when we will have our regular class, I will tell you the role of interleukin 1 and TNF alpha in more detail. What I want to discuss are the 3 questions which came in these 2 papers, the November AIMS 2019 as well as NEET. Now, starting with the first one. 33-year-old male presents with history of calf pain, swelling, low-grade fever, serum creatinine kinase was elevated. Muscle biopsy shows eosinophils, which is primarily responsible for increase in eosinophils. Now see, it was a lengthy question in the sense that 7-8 lines were written, but the main point was the last line, in activation of eosinophils. Most potent is interleukin 5, followed by interleukin 4. So among the options provided, the best answer is interleukin 4. Next, this was the November AIMS easy. Which of the following causes vasodilation? Bache, the name tells you. Thromboxane helps in thrombus formation. This helps in thrombus formation. So it causes vasoconstriction and increases platelet aggregation. It causes vasoconstriction and increases platelet aggregation. versus the other two, that is prostaglandins and prostacyclins, which cause vasodilation and reduce platelet aggregation. So the answer was D, that is both A and B. Next. This was again this November names question. Interleukin produced by basophils. Interleukin 4. We have already seen that the most potent activator of basophils, interleukin 3, followed by interleukin 4. So let us have a quick look at this. Interleukin 4. This plays a role in allergies and production of IgE antibody. We have seen because interleukin 4 plays a role in activation of both eosinophils as well as basophils. Eosinophils 5 by followed by 4, basophils 3 followed by 4. Next point, interleukin production by basophils. It is a key event which causes allergic reaction and expulsion of parasites. How does interleukin 4, what does it do to the basophils? It causes pro-survival signaling and delayed apoptosis, that is reduces the apoptosis. Lastly, this was stimulation, that is reduced apoptosis in basophils or activation of basophils as interleukin 3, 4 and granulocyte monocyte colony stimulating factor, GM-CSF. These are the three which reduce apoptosis versus induction of apoptosis, which this is an important prospective question. Interleukin 18 and interleukin 12. Please put a double star on this. Extremely important. Interleukin 18 and interleukin 12 induce apoptosis in basophils. This is a prospective question. Done. This takes care. Prostaglandins and prostacyclins, they cause vasodilation. You were right, Venkat, you were right. Prostaglandins and prostacyclins, they cause vasodilation. PGD2, E2 as well as I2. I2 was not given in the options, na? That is why I did not discuss PGI2. I did not discuss the arachidonic acid mediators in this topic. We'll do that as a separate topic, not to worry. Done. So this takes care of our today's discussion, and it was nice interacting with you guys. Thank you and good night.